The following is a paid program brought to you by My Philly Lawyer. The views and opinions expressed are those of the sponsor and do not necessarily reflect the views and opinions of the station and its management.
Good morning. Court Radio is now in session. Call 215-227-2727. When you've got legal questions, we've got the answers. This is Court Radio. And now here's your host, Dean Weitzman.
Good morning and welcome to Court Radio. I'm Dean Weitzman and this is your hour to ask legal questions. Just give us a call at 215-227-2727. That's right. If you've been sitting on your legal question all week, if you've called the office and haven't gotten a call back, just kidding. You can reach me right now. You got an hour. We'll try to get you on the air. 215-227-2727. That gets you in the door. You have to clear Monica to get to the question you want to ask. But that's pretty easy. Monica's pretty easy about that kind of stuff. She doesn't really block too many people. But again, the number is 215-227-2727. Court Radio is now in session. You know, things are crazy in Southwest this morning. Late breaking news. 52nd and Wyalusing is underwater. A huge, huge water main break. You know, there's going to be claims from this. Question, who's liable when there's a water main break? And what happens if you don't have insurance? What kind of car insurance covers cars who are caught underwater? Well, for these questions and others, I've got my special guest host, the owner, the man in charge of Center City Medical, Benjamini. Good morning, Ben.
Good morning, Dean. How are you?
I'm doing well. Just get right up to that microphone. Don't be shy.
I'll try not to.
There you go. You know, I gave a seminar yesterday to some folks down at McGee Rehab. We were talking about auto insurance and what's the appropriate auto insurance and what kind of policy makes the most sense. And we were kicking it around down at McGee Rehab it was an in-service for the employees of McGee Rehab. And they all got something out of it. But, you know, when it comes to, like, what's going on right now, 52nd and Wyalusing, when your car's underwater, and literally there are vehicles under 3 feet of water in Southwest right now. And once a car is underwater, it's done. Car's totaled. There's no hope for it. It's over. Can't be put back on the road again. Flooded car, done. Who pays for it? Well, you better have comp, as in comprehensive insurance. There's a part of your property, your auto coverage called comprehensive or comp. And frequently you'll hear people say, I have comp and collision. Well, that's the comp part. The comp part is floods, fires. It's not an accident. It happens while the car is stationary. No, you weren't involved in a collision where 2 vehicles crashed, or your vehicle crashed while in operation. So the comprehensive is usually for theft, for fire, for flooding. And if you have that coverage, then you're in luck and insurance will pay for it. If not, you're going to look for somebody who's at fault. You're not sure if you have it. Well, you know, you don't need to have any of those if you have a car that you're willing to lose. Like if it's not worth all that much, then I would always suggest to my clients to take the dollars they save by not having comprehensive and collision and getting better coverage for their uninsured and underinsured motorist. In any event. Hey, also, there's some other things that came up in the news that were shocking to me. Shocking. Know what they are?
No, but I do have a quick question.
Go ahead.
On a comp claim,
Yes.
does the insurance company have the right to increase their premium the following year or when it's renewed?
That's a wonderful question. And there's actually a statute that I've located in the Pennsylvania statutes, which say that if it's not a chargeable accident, and chargeable means that you are at fault for causing the loss, then your carrier does not have the right to raise your rates. And so, thank you for that question. California, L.A. just passed a law. I know you were thinking about relocating. You know, you're a movie star. And L.A. just raised their minimum minimum wage to $15 per hour. So if anybody's looking for a better paying job, apparently L.A. is the place to go. I mean, even if you're working in a place like Walmart, say, if they're in the city limits of Los Angeles County, then you're entitled to be paid $15 an hour. What do you think about that?
That's amazing.
Yeah.
I think that's a good thing.
Yeah, I mean, you know, it's the interesting thing about the whole minimum wage law is that it really is jurisdiction by jurisdiction. It is not a federal law. And so each state mandates what their minimum wage is. Here in Pennsylvania, it's $7.25, I believe. And in D.C., it's $9.50. So it varies widely from state to state or jurisdiction to jurisdiction. And it's something that is still a law that is left to the states to decide. 215-227-2727. We got calls coming in. Let's talk to Frank from North Philly on line 1. Hey, Frank, welcome to Court Radio.
Yes, I have an easy question.
So you say. All right, but go ahead. Is this the first time you're calling into Court Radio?
This is my first time calling.
Have you been listening?
Yes.
Like kind of off to the side, quietly listening. Sometimes do you?
Before I go to church on a Sunday morning, I catch it. I leave out early, so I was trying to catch it because I wanted to know the answer to this question.
All right, go ahead.
Concerning the personal injury, and when the personal injury case goes to arbitration.
Yes, sir.
Is there a limit to how you can receive in arbitration on a judgment?
Yes. Yes. In Pennsylvania, the limits are $50,000. So if you will never be awarded more because the arbitrators. Now this is let's get something straight here, Frank. This is the common pleas arbitration. It is the court-mandated arbitration. It isn't a private arbitration because there's a lot of arbitrations going on these days, private and whatnot. But this is the one that when you have a smaller case and your attorney files a complaint and he asks for $50,000 or less, he or she goes to arbitration in Philadelphia or whatever the county is you're in, and the maximum the arbitrators can award you is $50,000 per person. So if there's two of you, you can each get $50,000.
Now, if you don't want to agree to that amount, if you think that your case should award you more, then what would be the second step?
Well, you can take an appeal from the arbitration. So let's say that you got the maximum, $50,000.
Right.
And you think, wow, my case is worth more than that. So an arbitration is never the final step in a process. If either side, either the plaintiff or the defendant, chooses to take an appeal, they're entitled to do so, and it's a de novo appeal. The case starts over again. The interesting question is, if you asked for, the only way you start as an arbitration is when you file a lawsuit and you ask for $50,000 or less. $50,000 or less. And so if you want more than $50,000, if you think your case is worth more than $50,000, all you do when you file the complaint is you demand more than $50,000, and then you bypass the arbitration process in its entirety, and you go straight to a jury trial or a bench trial, depending on how the complaint was pled. And so you can bypass that arbitration process.
Okay.
You don't
So
have.
that would be
You don't. Yeah.
that would be solely up to whether or not I agree or my attorney
Exactly.
would agree to that.
If you
yeah.
If you or your attorney think that the case has value greater than 50, then you just, in the beginning, when you write that complaint and you sue the other person, you ask for more than 50. You bypass ARB and go straight to jury.
Okay. Good enough.
Hey, Frank, have a good time in church today. Thanks for listening to Court Radio. Hey, Frank, stay on the line. I'm gonna get Monica to get your address for a first-time caller. You're getting a T-shirt from Court Radio.
All right. Thank you.
All right, hold on.
All right.
All right. You know, when Dr. Benjamini's in the house, because you're here, once in a while, we like to talk about Center City Medical. And, you're under contract to give me at least 1,000 words today, and you've only broken out about, 8 or 9 of them. So, let's see. First of all, when did you form? You formed Center City Medical?
Yes.
When?
I'm going to say 1996.
1996. Is that, when you graduated from chiropractic school?
Yes, that's true.
Wow, right out of the gate, you were an entrepreneur.
Thank you. Yes.
Well, how did you get to chiropractic school? Like, what is somebody? When does somebody decide they're not smart enough for medical? I mean, when did they decide? No, when did you decide that chiropractic school was for you?
During college, when I was studying for prerequisites to get into.
Where'd you go to college?
In Los Angeles, a couple of local schools.
$15 an hour.
That didn't happen when I was there. Otherwise, I wouldn't have moved out. But,
you were living in L.A.
California, yeah.
Living the L.A. life.
Yeah, I was. I grew up there.
Really? See, I knew that. I didn't know that, but I could just look at your face and know that you were a California guy.
That 10 line on me. Huh?
Yeah. So you're out in California. You're going to college. Did you graduate college?
Well, I graduated a 2-year school.
Okay.
In a way, and I got my prerequisites at various other local schools there, West Coast University and so forth in West LA. And then I entered chiropractic school, which was about a 3.5-year program.
So now, okay, let's get back to what was it that you just that compelled you to go to chiropractic school?
The interest in the healing art of the body, using the non-conventional medicine approach, where you engage in medication and other more invasive procedures. So I've always found it intriguing how the body can respond to other therapeutic approaches.
Do you manipulate?
Of course, as a chiropractor, we provide manipulations.
Well, and does manipulation handle things besides just an achy neck?
So the question is yes. The manipulation that we as chiropractors provide is not limited to the spine, to the neck and lower back. We also know how to mobilize and manipulate other joints, the extremities, the elbows, the knees, the ankles. Any joint that articulates has the possibility to move as it is by definition. And so when a joint does not move properly, it needs to be adjusted, as we call it, or mobilized, or corrected.
And what does that adjustment do?
Well, it corrects the function, allows the joint to properly move and engage in the function that it should. When it's out of alignment, when it's injured, it doesn't function. It doesn't function properly.
What if somebody wasn't injured? They're just, like Larry. He's just, he's a guy who might be a little out of shape. He sits behind the desk a lot, doesn't really work out too much. he's kind of a lump, like a couch potato. Does he benefit from chiropractic manipulation?
Well, everybody benefits from chiropractic manipulations. By the understanding of chiropractics, we allow for the spine predominantly to be free of any interruptions that are caused by misalignments or by poor body habitus and posture. So by correcting the proper posture of the spine, we provide you with better tools to function and to, use the spine to be mobile.
Do you increase the chi? What's a chi? Have you seen a chi yet?
I haven't.
Okay.
I haven't seen the chi.
I think chiropractors have gotten like a bad rap, and I'm trying to understand why that they're not taken as seriously as I think they should be. I don't know where it comes from, but I'm going to ask you about that in a second. But let's talk to Diane from South Philly. Hello, Diane. Welcome to Court Radio.
Good morning,
Good.
Dean and Doctor today. How are you?
We're well, thanks. Thank you for calling us. What happened to you?
Yes, I was on my job. We were practicing a fire drill, and my director asked me to help her, and I did. And I had a baby in one arm, and I was lifting my right arm, pulling up the crib, and I hurt my wrist. But it didn't bother me until later on that evening when I went to the emergency room because it was throbbing. My question is, what do I do when I have to get a lawyer when I don't? What are the procedures if you don't get paid? I didn't receive my pay when I was out. Now I'm back to work doing light duty. I don't want to lose my job, but I do need to know what are my rights as an employee, which we don't have a union, of course.
Right.
But what do I need to do is to get to the point that they will not pay me for the week I was out. And also, I think they're trying to use my time that I accumulated, like if it was vacation or annual time. They use that if I'm out on workman's comp. And I went to the workman's doctor. I'm not disputing anything, and I'm following their directions, not giving them a hard time. They call my workman's comp doctor. Without mentioning anything to me, I guess they can do that. Now I'm up to the point that I can't pick up anything over 20 pounds.
Okay,
so basically I'm doing light work.
Here's the answer to your question. First off, My Philly Lawyer, it's what we do. We do workers' comp cases all the time. This is a run-of-the-mill case, but it's one that you have to be careful with in every workers' comp case because you want to make sure that your injuries are well documented. In the event that you cannot do your job, then they either must provide you with a light-duty job, which you can do, or there are certain people who cannot be provided a light-duty job. And so they may be able to do a light-duty version of their job, but if none is available, then they're entitled to receive workers' compensation, and they are disabled from their work. And that's the key. If you're not, either if they cannot provide you with a light-duty job or you're not able to do your job in any capacity, then you're entitled to your wages. With workers' comp, you have to be out of work for more than 5 days before it kicks in. If you were out more than 5 days and they didn't provide you with a light-duty job, then you should not have to use your sick time. You're entitled to your workers' compensation. And let's say you're out for 10 days. They don't just go back 5. They need to go back all 10 and pay you even during the waiting period. But you have to get past the waiting period in order to have an eligible workers' comp claim. And the waiting period is 5 days. If you were out for 3 days and then they brought you back and gave you light duty and you're capable of doing light duty, then you don't get those 3 days. And then you are using sick time or accumulated.
Because they tried to make me come back Thursday. I came back, and then when I told them, I said, listen, I'm not doing anything that messes with my wrist because I'm still in pain. All of a sudden, they flashed me over to a workman comp doctor. Now I have to get an MRI tomorrow, and I'm still in light pain. It's still stiffness there.
Well, you're doing the right thing. You make sure that they give you
a record of everything.
And you make sure they give you treatment, and you tell and you let the doctor know everything that's bothering you and when it bothers you and what activities could increase your pain so that all your complaints are well documented.
Okay.
And if they're still giving you trouble next week and you really don't feel like you can do your job, by all means, you're entitled to have a conversation with me or with my team who's doing workers' comp.
We met before. I have when they had the Black History, Martin Luther King Day, and I won the free tickets. I have a picture of you, but I lost my phone. But at least I still remember what you look like. You're great.
Thanks, Diane. Thanks for listening to Court Radio. Hey, listen,
have a blessed day.
Stay on the line. We're going to get Monica to get you a Court Radio T-shirt.
Okay, I'll wear it with Proud from South Philly.
All right, thank you. Hold on the line.
Okay.
So Diane's question is great because it lets me ask you this. Do you handle workers' comp claims?
Of course we do, yeah.
How is that different than than any other injury claim? Is it different?
There is no difference in terms of what we can provide. Again, I'm dealing with a body, so an injury is an injury, and you have to address it accordingly, depending on what region it is. In Diane's situation, it is the wrist. I think it's important that she follow up and get examined, not only with the workman's comp doctors, but with outside doctors. For example, an orthopedist should evaluate her wrist and determine whether she has any pathology that needs further actions.
She had mentioned she's getting a test called an MRI. What is that, and what does it show?
A magnetic resonance imaging is known to show us the tendons, the joint space, the ligaments around the joint. It's different than an X-ray in that an X-ray is focused on showing us the alignment and the bony structure. An MRI is a bit more invasive in terms of what it shows inside, and it can tell us whether there is any joint damage that involves the soft tissue part of it.
Is that something that you use regularly in diagnosing for your own patients?
We use it routinely when we feel that there is some pathology or some injury to the tissues within the joint and surrounding it. Yes, we use it.
What's the most common problem people have when they come to see you?
Well, it all involves the joints. A large percentage of the practice deals with the back, which is the spine. But injuries like wrist extensions and sprain and strains of the knees and ankles are also treated at my facility. Is there a typical treatment protocol that your patients could expect to undergo? I don't think there's anything typical. Every patient has their own set of circumstances and different traumas and injuries that require a tailored approach. Initially we evaluate the patients and determine what needs to happen, what type of treatment protocol, as you say. Some patients begin with a more passive approach, wherein we will provide various modalities and therapeutic methods to reduce the swelling and increase the circulation. And some patients will jump them right into active and aggressive strengthening and exercise programs. So there is no, approach that fits everybody. Every patient has a different mechanism, a different region that's injured, and requires specific guidelines.
Is it uncommon for these kinds of injuries to become permanent or to bother folks for a long time?
When Diana, for example, spoke to us about a wrist injury, wrist has a lot of the wrist is a small joint made up of many small articulations which are held together by ligaments and tendons. And so, as with any joint that has ligaments and tendons, and specifically the wrist can result in permanent damage because it does have a lot of ligaments and tendons. And these tissues require immediate attention, and many times the MRI is a good tool to find out what type of damage internally is located, and if so, she needs to be managed by an orthopod and to get physical therapy or some kind of physical medicine. Yeah.
Do you provide physical therapy at your center?
As a chiropractor, we are not termed as physical therapists, but we utilize various modalities and therapies that are very similar to what one would get in a physical therapy setup.
We got a caller. Let's talk to May from West Philly. Hey, May, welcome to Court Radio.
Hi, how are you? My question is about insurance for a bike rider. When two bikers collide and one is injured and has to have surgery because they broke a bone, is that covered under your homeowners or car insurance?
Okay, so a motorcycle is like any other. No.
No, it's not a motorcycle. It's a road bike, a bicycle.
Bicycle, okay.
Yes.
Okay, so you got an injury while riding a bicycle, crashing into another bicyclist.
Yes, or another bike crashes into you.
Right. Okay. Yes, I believe that in this case, first of all, your medical bills probably would be addressed by your medical insurance if you have any. Then the question is, are you going to be able to collect for your pain and suffering? And I think the answer is yes. If you're a bicyclist and you do something negligent, let's say you don't stop at a stop sign. I mean, bicyclists have to follow all the rules and regulations of motor vehicles. So that means they have to stop at stop signs. So a bicyclist is coming through an intersection, fails to stop, and poor May is driving through that same intersection where you don't have a stop sign, or there was one and you stopped. So you're not negligent. You're in the middle of the intersection, and the bicyclist who is negligent blows through the stop sign, crashing into you and injuring you. Do you have a claim against that bicyclist? Yes. Will that bicyclist homeowners pay if they have homeowners? Yes, I believe they would. Does that answer your question?
Yes, it does. Yes.
No auto insurance unless the vehicle is a registered motor vehicle. That's a motorcycle or a car or a truck or whatever. It's got to have a license plate on it in order to be covered by auto insurance. Bicycles aren't covered by auto insurance, but if someone's operating a bicycle negligently, I believe that would come under the general liability of one's homeowner's policy.
Okay.
May,
okay.
You know what? I've been doing this, May. I've been doing this for like 8 years. 8 years. I get up every Sunday morning and I answer people's questions. I got to tell you that you're the first person in 8 years that was a bicyclist injured by a bicyclist.
Well, actually, I wasn't injured.
Right.
One of my club members was injured on a bike.
Okay.
And the question was brought up, and I said, well, check with your homeowners or your car insurance.
So wait a minute. So you're a member of a biking club?
Yes.
Oh, good. And it.
Well, why did you say it like that?
What's the name of this club?
Oh, Biking Blazers.
Biking Blazers. Wow.
Yes.
See, that already, you got to watch the names because it already sounds like you guys are speed demons, like you're blazing through intersections.
But that's not true.
Not true,
That's
no.
not true.
No. How many members of your club?
At present in Philadelphia, it's 89 members.
89 members. Wow.
Yes.
You know what I think, May? I think you ought to get in touch with Monica, and you ought to have a little Court Radio My Philly Lawyer special presentation for the club members.
Oh, that sounds good.
Yeah. I might make myself available. I'll come down with a bike helmet, my elbow pads and all that stuff, and we could talk about what we can talk about what the question you just answered. You just asked.
Oh,
so May,
yeah.
I'm giving your little slip here back to Monica, who's going to get on the line, get your contact information, and we'll see if we can coordinate and do a Blazers My Philly Lawyer get together.
Oh, that would be great because there's so many bicyclists now and clubs that we need to know.
Yes,
when it comes to injuries.
I agree. Where's the club members meet?
Well, we meet at different members' houses and things like that.
Okay, all right.
So,
and I mean, I do own a bike.
you do? Oh,
yeah.
Do you really?
I do.
Okay.
Yeah, and I bike once in a while, so I might learn something too. Yeah.
You might.
Larry called me out on that. All right. Well, it was last season, but I mean, I have biked, and I did get my bike serviced this year. Got it all oiled up and ready to go.
Okay.
All right, May.
Oh, nice. Okay, thank you.
Stay on the line, dear. Stay on the line. 215-227-2727. We're talking to Benjamini. And by the way, hey, listen, we can't have a court radio show without my asking, how could your parents have named you Benjamin when your last name is Benjamini? It's cruel and unusual. I think that we should bring a complaint against them or something,
Does homeowners insurance cover that?
I think I can get homeowners to cover anything. And negligently naming your son is definitely, I think, it would be unique, but I think we could do it. We're going to take a quick break. We're going to be right back in 2 minutes, folks. Keep those calls coming.
If you have legal problems and need answers, call My Philly Lawyer, Dean Weitzman, first at 215-227-2727 for personal injury, medical malpractice, birth injury, and more. Call Dean first.
He will fight for your rights. That's what Dean Weitzman is all about.
Call My Philly Lawyer, Dean Weitzman, first. 215-227-2727. My Philly Lawyer, when winning matters most. For 20 years, Center City Medical Center has provided premium expert medical services for Philadelphia. Whether you need musculoskeletal rehab or an immigration physical, call 888-945-EXAM. Our board-certified physicians have more than 80 years' experience from post-injury rehab to DNA paternity testing. To make an appointment at one of our 3 convenient locations, call 888-945-EXAM. Get premium expert care. Center City Medical Center, serving Northeast, North, and Center City, Philadelphia. If you've been injured on the job and are entitled to workers' comp, you need someone fighting for you from the start. Call Jeffrey Gross, attorney at law. Don't rely on your employer or insurance company to get it right. Call 215-512-1500. If you're entitled to workers' comp or it's being challenged, Jeffrey Gross can help get the money you deserve, and he won't get paid unless you get paid. Call 215-512-1500. Jeffrey Gross, attorney at law, representing Pennsylvania's injured workers for more than 20 years. It's a legal and financial squeeze. You're unable to work because of an accident, but your legal case is still not settled, so you can't pay the bills to take care of your family. But now, thanks to U.S. Claims, you can. If you have a pending lawsuit, call 1-877-U.S. Claims. While you're waiting for your settlement, U.S. Claims can help you pay the bills. Get out of the squeeze. Call 1-877-U.S. Claims today.
The following is a paid program brought to you by My Philly Lawyer. The views and opinions expressed are those of the sponsor and do not necessarily reflect the views and opinions of the station and its management.
Need more legal answers? Here's more Court Radio with your host, Dean Weitzman.
Good morning and welcome back. It's Court Radio, and I'm Dean Weitzman, your host. If you got legal questions, I've got the answer. 215-227-2727. That gets you in the house. You can do it. And when it's not court radio, that number will get you over to My Philly Lawyer. You like how I did that? We use the same number for court radio as we do for My Philly Lawyer, so people only have to know one number. Legally speaking, in Philadelphia, surrounding counties, all you got to know is 215-227-2727. And do you know how I got that number?
No.
No, of course not. I had a dream. I had a dream about a number that was associated with car crash. And if you spell out car crash, it's 215-227-2727. And I woke up and I called the number, and it was somebody's number, a Spanish guy. He was talking, I assume he was Spanish because he was speaking Spanish, unless he was just trying to fake me out. And he did, he had the number for a little while, but then I kept after him, and finally he let the number go. He probably thought I was like, I don't know what he thought I was, but I did tell him I was a lawyer, and I did tell him I was willing to pay for the number. But, he just gave it up and ran away from the number. And then I got in touch with Beltel. That goes back, huh? Beltel. And they gave me the number. And it does spell car crash. So there you go. But we do more than car crashes. We do bike-on-bike offenses. Yes, May called in with a bike-on-bike. Bike-on-bike. Could you believe that? If somebody were injured on a bike-on-bike accident, would you treat them?
Of course,
You're not prejudiced against bike-on-bike?
No, absolutely not.
All right.
Traumas are trauma.
Larry is, though. I can see it in his eyes. He's thinking... He's thinking bike on bike. No way. I mean, he's just getting accustomed to gay marriages and stuff like that. He refuses to accept bike on bike. But if it happens, you're going to treat them.
The most important thing is wear a helmet. Wear a helmet. All jokes aside.
That is good advice. Yeah.
Wear a helmet.
Because you can help somebody with broken bones, but when you have an injury to the head...
that could be debilitating.
Yeah. I represent a lot of people who actually have traumatic brain injuries, and it is a life-threatening and life-changing injury. So, yes, we do always wear helmets at My Philly Lawyer. All right. We're going to talk to George on line 4 now that I'm done laughing. Hey, George. George is gone. Oh, well. My condolences, George. Let's talk to Daniel, because I just need to hit somebody from North Philly. Hey, Daniel, welcome to Court Radio.
How you doing?
I'm doing good now. So you're from North Philly, huh?
Yes, sir.
Whereabouts?
Around 8th and Lehigh.
Wow. Okay. I've been to 8th and Lehigh.
It was the old Edison High School. It's down there. It's a little market square now.
Yeah. You're just down the street from 2nd and Lehigh.
Right.
So what's going on in North Philly, Daniel? What do you got on your mind? What's the question?
All right, my question is, I was involved. I was attacked in a bar, the neighborhood bar, and I want to know: do I file a criminal charge first and then a suit, or do them both together?
Well, let me ask you something, Daniel. Do you know who attacked you?
I don't know their names. Excuse me one second. She's on with Grizz.
She's on with Grizz?
Yes. Yes, what it was, we carpet.
Daniel.
Small. I'm sorry, sir. Listen, yes, what it is, yes. I was attacked in a bar and I got injured.
Last night?
No, this was It was 6 months ago.
6 months ago. Okay. And you don't know who attacked you.
No, I don't know their names.
You don't know their
The
names.
owner of the bar, it was his relatives, sons and nephews.
The owner of the bar's relatives. Okay. So the answer is, if you're attacked, it's an intentional act. Usually insurance is not going to pay for that kind of a claim. And usually I'd advise clients in that instance to proceed with a criminal prosecution. You go down to the district attorney's office, you explain what happened, they decide whether they're going to press charges, and if you have some medical bills, you can get those paid back either through the Crime Victims Fund or through restitution. There are exceptions, sometimes there is negligence involved. A bar doesn't provide proper security. They constantly have fights. They refuse to spend the money to have security, or this fight brewed for a while and they didn't do anything to intervene. I mean, there are exceptions, but the way you described it, I would say that your best bet is to start with criminal prosecution and see if you can interest the district attorney in pursuing it. Daniel, thank you for calling Court Radio. Have a great Sunday and enjoy that coffee you just ordered. 215-227-2727. Yes, sirree. That gets you in the door. Let's talk to Tracy on line 2. Hey, Tracy, welcome to Court Radio.
Hi, how are you?
I'm well, thank you. What's up in Tracy's life today?
Okay, I was in a car accident on Thursday.
Okay.
And one car was trying to pass the car that I was in. The driver was going into the other lane. The girl was trying to inch up beside her. The next thing I know, it pounded inside the driver's side. The passenger side, which I was on. I had my seatbelt on, but it jerked me like back and forth.
Sure.
So my question is can I go after both parties?
Yes, you can, and yes, you should. When you have an accident, sometimes it's clearly only one driver's responsibility. For instance, you're sitting at a red light, minding your own business, ba-boom, you get hit in the rear. That's 100% usually against the car that struck the stopped car. But almost every other accident has some component. One might be primarily responsible, but some component of the total is broken down between two or more vehicles. You, though, are a complete innocent guest passenger. And so if the value of your case, let's just say that you suffer with these injuries for 6 months and you get better, and you've got a case worth whatever, $15,000, that might be 20% or $3,000 the responsibility of one operator, and $12,000 or 80% the responsibility of the other operator. If you only pursued one operator, you would be waiving your right to compensation from that portion that's the responsibility of the other operator. So you really have no choice. Your job, though, is to get better, Tracy, and get treatment.
Yeah.
That's what Dr. Benjamini does. How does she get in touch with you if she needs to set up an appointment?
215-735-8.
215-735-8.
477.
No. Hold on, Tracy.
You're giving me her number.
Yeah, I'm giving you Dr. Benjamini's number so that you can call him on Monday morning and get yourself an appointment to get checked out.
Yeah, it's 215-735-8052.
Thank you.
And listen, if you don't have representation, you call my Philly lawyer at the number you called for Court Radio, Tracy.
Yes, sir.
All right. Have a great Sunday, and thanks for listening to Court Radio.
Thank you.
All right. Be well. 215-227-2727. That's the number Tracy needs to call. We have operators on duty 24 hours a day, 7 days a week, 365 days a year. My Philly lawyer never closes. Never. When you need us, folks, you just need to dial that number, 215-227-2727. But through the magic of phones, for 1 hour on Sunday mornings, that number is directed to Larry. And then the other gazillion hours all week long, it goes right to my Philly lawyer. Isn't that amazing? Yes.
Technology.
Okay. I didn't impress you, but there you go. So let me ask you something. What are some of the common misconceptions about chiropractic care?
Misconceptions. Dean, that's a tough question.
I know.
I don't know where to start or where to finish. A misconception. That we just treat the spine. That's a common misconception, where in fact you are trained and capable of diagnosing problems that are outside of the spine, like I mentioned, a shoulder, elbow, knee, and ankle. Another misconception.
Can you adjust somebody on the fly? Like if I just laid down here in the studio, would you be able to adjust me?
Of course. Well, you'd first have to find what's out of place and what needs to be corrected.
Well, when things are like something like somebody like me, when so many things are out of place,
you're done. You're history.
I mean, how do you begin? How do you even know where to begin?
Well, usually you take a history from the patient of what bothers them, what hurts them, what have they done that brought the pain or discomfort. And then you examine and evaluate that region to start with. And you also, keep in mind that there is other joints that are articulating. The spine is connected to your sacrum, to the pelvis, and that could affect your knees and your ankles. So, Dean, you may come to me and say, my knee hurts. And I'll focus at the beginning on your knee. But you got to remember, your knee is connected to your pelvis, and the pelvis is connected to your spine.
Can you do that song?
Not now. However, there could be some problem and a misalignment in your pelvis, which causes a secondary compensatory problem in your knees.
It's funny you should mention that, because a lot of times with my clients, as a result of the injuries that they've sustained, they have something called radicular symptoms.
Right.
What is that?
Radicular symptoms are symptoms that are traveling from one point down to another point. And when I say down, what do I mean by that? There is a radicular component that could be stemming from your neck and from your lower back. That means that there is some nerve damage that's taking place either in the neck or the lower back, and is referring the pain pattern to your hands or to your toes, down your arm and down your thigh and to your leg. So a radicular component, the patient may be coming and saying, look, I have this numbness or tingling sensation along my thigh or along my lateral foot. And
wait. What part's the lateral foot?
The outside of the foot.
Ah, okay.
So they would be thinking, well, that's where my problem is. That's where I injured.
Right.
My foot or my thigh.
And you're adjusting, you're listening to them, but you're playing with their back.
I'm listening to them and I'm thinking, okay, let's try to understand what's wrong with them, because the problem is not your thigh, the problem is not your foot. That sensation is stemming from the spine, from the lower back in that instance. So as I said, the misconception is, we're just treating the spine. But yet you'll have people complaining or coming to us with extra spinal complaints, like your thigh, like your knee and your hands and your shoulders, which could be and many times is related to the spine.
Okay. Hey, listen, we got to give a shout out. Odoon Day celebration today at 23rd and South. Last year there were 50,000 people. Was that right? Is that right? 500,000 people at the Odoon Day celebration. Wow. All right. Well, if you want to go Odoon Day, and hey, it's the senator himself, you got to get to 23rd and South this morning, and you'll be there. Yes, he will. No, he won't. He's in a suit. He's going to church. All right. 215-227-2727. Give us a call. Yes. I want to talk to Victoria, because I haven't had anybody in Grays Ferry call us for a little while. Hey, Victoria, welcome to Court Radio.
Hi, good morning.
How are you?
I'm wonderful. I'm wonderful. I really can't complain, but I do have some complaints.
Okay. Well, usually that's the case when people call Court Radio. So don't feel bad. We're here to help you. So tell us what's going on in your life.
I actually had a question for you, but as I was listening to the chiropractor, because I have bilateral fractures to the feet, and I refused to get the surgery to my feet, which are doing wonderful, as I imagine that they are. But the flat part of the feet, he does chiropractor to that.
The flat part, did you say? The bottoms
flat,
of your...
You know, the flat part, like right up underneath the joint has caved in.
How did that happen? Did you, like, fall off a ladder or something? How'd that happen?
No, actually the sidewalk caught me. And, that's how I broke both feet.
Wow. So wait a minute. What was it, a raised sidewalk?
Actually, it was, like, busted up, yeah.
Wow. Okay. And so you broke your feet, and not one but both. How are you not walking around right now, huh?
Yeah, I am. This happened a year ago.
Okay.
But now I'm experiencing, I've been through the foot doctor, the whole enchilada. Also have things in my boots that they made for me. But now I'm experiencing, by listening to him, a lot of nerve damage, because what I'm getting from the feet has stemmed all the way up to the knee.
Okay, well,
and
all right.
Right when it has stemmed up to the middle of the thigh. I don't know if that's from me not getting the surgery. Is it something that he could treat?
Well, we're going to find that out. Let's let him answer you.
Well, it's something that I'd love to take a look at. Complex situations are not really intimidating anybody. But one has to understand, first of all, what you fractured. So it seems like you have injured
4
your...
and 5.
Say that again?
Both.
You fractured your ankle?
No, I fractured number 4 and number 5 on both feet.
Fourth metatarsal and the fifth metatarsal on each foot.
Got it.
Yes.
And right now you're experiencing pain, which seems to be going up towards that knee. Is that what you're saying?
That's absolutely correct.
You don't seem to have a sensation of pain traveling from the knee down to your feet.
Well, I don't know which way it's headed. Whatever way it's headed, I'm getting the pain that's all the way up to the knee.
Right. So,
I don't know.
So
have you had a recent MRI?
I haven't had an MRI at all.
Yeah, that's probably. I mean, I'm not. I'm jumping on your ship here, but you would think you need some diagnostic studies.
Well, she needs first a thorough examination to find out exactly where and how the pain is traveling, and then examine certain regions. It could be stemming from the back as well. That's not to be excluded. It could be coming.
I never hit the ground. I don't believe it's coming from the back. I've never had back pain.
But let me throw this out at you. You probably changed your gait, GAIT.
Correct.
And because of the problems with your feet, you're walking differently, or you were walking differently, and that could throw your back out, even though your back never hit the ground. Isn't that right, Dr. Benjamini?
That is correct, Dean.
I need to get with Dr. Benjamin.
That would be
I should
wonderful.
have taken his number.
Well, we're going to give it to you. We're gonna Victoria. We're gonna put you on hold, and we're going to give you Dr. Benjamini's number right now. Hold right on. Go ahead, Benjamini.
Give her the number.
Give her the number.
215-735-8052.
And 215-735-8052.
That's correct.
Does that spell anything?
Benjamini.
You no good rat fink. No way.
Doesn't spell anything.
Nothing. Nothing. See, you didn't have a dream.
No.
I had a dream.
You did.
Car crash. 215 car crash. That's what it spells. And I got it. I got it. You know why? Because I don't take no for an answer, and that's why my clients keep coming back. 215-227-2727. Do you massage organs?
No.
Okay, that was quick. What is a massaged organ? We'll ask you that when we come back. We're going to take a break. We'll be back in 2 minutes.
If you have legal problems and need answers, call My Philly lawyer, Dean Weitzman, first at 215-227-2727 for personal injury, medical malpractice, birth injury, and more. Call Dean first.
He will fight for your rights. That's what Dean Weissman is all about.
Call My Philly lawyer, Dean Weitzman, first. 215-227-2727. My Philly lawyer, when winning matters most. For 20 years, Center City Medical Center has provided premium expert medical services for Philadelphia. Whether you need musculoskeletal rehab or an immigration physical, call 888-945-EXAM. Our board-certified physicians have more than 80 years' experience from post-injury rehab to DNA paternity testing. To make an appointment at one of our 3 convenient locations, call 888-945-EXAM. Get premium expert care. Center City Medical Center, serving Northeast, North, and Center City, Philadelphia. If you've been injured on the job and are entitled to workers' comp, you need someone fighting for you from the start. Call Jeffrey Gross, attorney at law. Don't rely on your employer or insurance company to get it right. Call 215-512-1500. If you're entitled to workers' comp or it's being challenged, Jeffrey Gross can help get the money you deserve, and he won't get paid unless you get paid. Call 215-512-1500. Jeffrey Gross, attorney at law, representing Pennsylvania's injured workers for more than 20 years. It's a legal and financial squeeze. You're unable to work because of an accident, but your legal case is still not settled, so you can't pay the bills to take care of your family. But now, thanks to U.S. Claims, you can. If you have a pending lawsuit, call 1-877-US-CLAIMS. While you're waiting for your settlement, U.S. Claims can help you pay the bills. Get out of the squeeze. Call 1-877-US-CLAIMS today.
The following is a paid program brought to you by My Philly Lawyer. The views and opinions expressed are those of the sponsor and do not necessarily reflect the views and opinions of the station and its management.
Need more legal answers? Here's more Court Radio with your host, Dean Weitzman.
Welcome back. It's Dean Weitzman, and this is Court Radio. And I was not being fresh. I'm joined in the studio with Benjamini, chiropractor to the stars, L.A. native and Philadelphia implant, the head and chief operating officer of Center City Medical, and the sponsor for Court Radio. Welcome back, Ben.
Thanks for having me.
You got 30 seconds. What's a massaged organ when it comes to chiropractic care?
So I do not know what a massaged organ is, but from speaking to some of the people around, they wanted to know whether I can move or mobilize an organ. And I think that question stems from a lot of patients going to the ER complaining of side pain in the flanks. And at first they're told in the ER it's just a muscle spasm, and they're provided with muscle relaxants, and they go home, and excruciating pains develop. They can't sleep at night, and soon enough they learn that it was a kidney stone. So can we mobilize the kidney because there was significant back pain? The answer is no. I don't know how to move the kidney, nor do I know how to move the stones inside the kidney. But as much as it sounds funny, the patients present with severe lower back pains. And
another example of it isn't always what it appears to be.
That's why a thorough examination and a history is important at any given time, whether it's immediately after or a month later. It requires a thorough evaluation.
Thank you very much. Unfortunately, folks, we're all out of time. If you've got questions, you got legal needs, call us during the week at My Philly Lawyer, 215-227-2727. Benjamini, thank you for joining us at Court Radio, and we'll see you soon.
Thank you very much.
All right.